It happens, particularly when flu was really hitting us hard. We definitely had a handful of cases of COVID and flu, or RSV and flu. So, it's just playing the percentages. If a kid in their early years of school or kind of late preschool, they tend to get about 10 colds in a year of some kind of respiratory virus. And, if you've got a high prevalence, there's just a lot of flu flying around, and there's a lot of COVID or a lot of RSV, some of those kids are going to get them at the same time. So it definitely happens. And it generally means you're going to feel worse, but it's not necessarily anything to lose a whole lot of sleep over. It just because you have more than one doesn't mean you're for sure going to go to the hospital or anything like that. You just want to follow the standard advice and stay hydrated. And if you're having trouble breathing or fevers that are lasting a long time, of course, call your doctor. Those are kind of our two that are generally safe to use in most children. So no, there's not another alternative other than Tylenol or ibuprofen. And in particular, Tylenol only if you're younger than 6 months. No ibuprofen if you're younger than 6 months. So it's pretty much those two. Sometimes like older kids will say, okay, you could probably take some Aleve. Once you get to be about adult size, you can do, which is naproxen. You could do an adult naproxen tablet for most kids who are 12 and up, so teenagers. But there's not a suspension. There's not an oral suspension. So primarily the issue has been the toddler age group and the infants. And as far as I know, I haven't heard of shortages of Tylenol capsules or pills, or ibuprofen capsules or pills. But adults could, generally speaking, if you can do ibuprofen, you could do naproxen or Aleve. So there are a few more alternatives there. Older adults can do some of the combo cold medicines. So things like NyQuil and, Alka-Seltzer Plus cold and flu, those kind of over-the-counter things generally have acetaminophen in them. So the main ingredient in Tylenol. So those kind of things provide some symptomatic relief from, most upper respiratory stuff.